Hello everyone. Welcome to our new video. Let's read the case notes first. Notes: Mr. Gerald Baker is a 79-year-old patient on the ward of a hospital in which you are a charge nurse. Patient details: marital status, widower, 8 years. Admission date, September 3, 2010, City Hospital. Discharge date, September 7, 2010. Diagnosis: left total hip replacement. Ongoing high blood pressure. Social background: lives at Grey Walls Nursing Home for 4 years. No children. Employed as a radio engineer until retirement aged 65. Now aged pensioner. Hobbies: chess, ham radio operator. Sister: Dawn Mason 66, visits regularly, very supportive, plays chess with Mr. Baker on her visits. No signs of dementia observed. Medical background: 2008, osteoarthritis, requiring total hip replacement surgery. 1989, hypertension, ongoing management. 1985, Cole's fracture, open reduction internal fixation. Medications: aspirin 100 mg main, recommenced post-operatively. Ramipril 5 mg main, Panadiene forte, Cocodamol, 2, 4 times a day p.m. Nursing management in progress, daily dressings, surgery, incision site. Range of motion, stretching, and strengthening exercises. Occupational therapy: staples to be removed in 2 weeks, September 21. Also, follow-up full blood examination, and electrolytes tests at City Hospital. Clinic assessment: good mobility post-operation. Weight bearing with use of wheelie walker, walks length of the ward without difficulty. Post-operative disorientation, re-time and place during recovery, possibly relating to anesthetic, continued observation recommended. Dropped HB post-operatively to 72, requiring transfusion of 3 units packed red blood cells. HB stable to 112, on discharge. Ongoing monitoring required for anemia. Discharge plan: monitor medications, Panadiene forte, preserve skin integrity, continue exercise program. Equipment required: wheelie walker, wedge pillow, toilet razor. Hospital to provide walker and pillow. Hospital social worker organized 2-week hire of razor from a local medical supplier. Now, let's check the writing task. Using the information in the case notes, write a letter to Ms. Samantha Bruin, senior nurse at Grey Walls Nursing Home, 27 Station Road, Grey Walls. Who will be responsible for Mr. Baker's continued care at the nursing home? In your answer, expand the relevant notes into complete sentences. Do not use note form. Use letter format.
So, let's start writing the letter. The address of the receiver is mentioned under the writing task. It is to Ms. Samantha Bruin, Senior Nurse at Grey Walls Nursing Home, 27 Station Road, Grey Walls. The date on the letter is the discharge date. Hence, it is the 7th of September 2010. Since the name of the receiver is mentioned, we can start the letter by greeting, "Dear Ms. Bruin." Next, write the RE line. Here, we have to mention the patient, about whom we are writing the letter. That is, RE, Mr. Gerald Bakes, 79 years old. I think the starting portion is clear to you all. Now, while writing the first paragraph, things to be remembered are: The patient is a resident of the Grey Walls nursing home. He is recovering after total hip replacement surgery. And today, he is getting discharged, and will be back to the Grey Walls nursing home, where he is going to receive continuous care. So, our first paragraph will be like this. I am writing in regard to your resident Mr. Baker, who is recovering after total hip replacement surgery. He is being discharged today back to your continued care. I hope it is clear to you. Alright. Moving on to the second paragraph. Here, we are going to mention the details of post-operation. This is just because the patient is a resident of the nursing home. Hence, we can avoid the patient's history, since it is a known patient. I hope it is clear to you. Let's have a look at the paragraph first. Then, I will explain it to you. So the letter goes like this. Mr. Baker's recovery period was uneventful. Post-operatively, he has been receiving daily dressing on the surgical site, and Panadine Forte for pain relief, along with his usual medications. His hemoglobin level was dropped from the normal 72. And it was corrected with the transfusion of 3 units of packed blood cells. He had an episode of disorientation, which probably due to the anesthetic effect. There were no complications mentioned in the case note. Hence, we started the paragraph by saying, Mr. Baker's recovery period was uneventful, followed by the medication details. Another point to be noted is that post-operatively, his drop in hemoglobin level, the count is mentioned in brackets, and it was corrected, as he received 3 packs of blood cells. Also, mentions the episode of disorientation due to the anesthetic effect, which marks the end of the second paragraph. Passing to the next paragraph, we can write about the post-operation improvements made by Mr. Baker. Thus, the paragraph will be as follows. During hospitalization, Mr. Baker was initiated with a range of motion, stretching, and strengthening exercises as well as occupational therapy. Consequently, he is able to walk with the help of a wheelie walker. Now, we have to write about the post-operative care required for the patient. Points to be included are as follows. Daily wound dressing, medication, observation, exercise regimen, removal of staples, follow-up on FBE and UEC. And, do not forget to mention the details of the wheelie walker, a wedge pillow, and the toilet razor. Alright. Hence, the structure of the paragraph is: upon discharge, Mr. Baker requires daily wound dressing, medication compliance, and continuous observation. He has to perform his exercise regimen for optimum mobility. His staples will be removed on the 21st of September at the City Hospital. And follow-up on FBE and UEC are to be done. He was provided with a wheelie walker and a wedge pillow from the hospital, whereas a toilet razor is hired for 2 weeks through a social worker from a local medical supplier. Hence, we have covered the necessary details to be mentioned. Now, let's conclude the letter. Conclude by saying the attachment of medical documents. That is, all the relevant medical documents are attached to this letter. Please feel free to contact me for further queries. To end the letter, sign off the letter with your designation. Yours sincerely, Charge Nurse. I hope the letter is clear to you all. Now, practice the same letter by writing yourself. Thank you. Be safe and take care.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.